right, as Lorna comes to the podium, let me just say, up to the beginning of this session, the previous sessions, we learned, I think, that this is all very complicated. And Peter's just reminded, no, that's just the beginning. It's even more complicated than that, and we'll come back to that. Lorna, over to you.
Well, with that note, I hope I'm actually going to simplify this conversation. And first, I just want to say thank you very much for having us here and having Mercer here. Thank you for the very nice weather in Washington, which is so rare in July. I am, just for this transparency, I'm a pediatrician, so I always like to say I can handle any questions about vaccines and bad behavior. And it's really a pleasure to be in Washington at an event where people are seeking consensus. So on that note, I will talk about really what the role of global employers, which are the employers that I work with, in universal health coverage. And again, kind of in the spirit of transparency and bias, I do think they have a role, and I think they think they have a role as well. That said, there's a pretty good response to this comment or question, which is they don't, right? So I work with for-profit brand name organizations who borrow money from shareholders in the form of a stock market to fund their investments. And they have to really meet the needs of those shareholders. And so the question in regards to universal coverage really has to fit within that context, right? So for them to understand what's the value component for their shareholders, they really have to understand it within a business component. And I think in a business context, and the very good news is that now is a really good time for that dialogue, and we'll talk a little bit about why. So I told you I do have bias, so I'm going to tell you what that is right now, so you don't have to ponder it. And that is, I think the role for employers is certainly just the extension of coverage through the existing formal schemes for their own populations, for employees. They certainly addressing management issues and efficiency issues, which certainly global employers have expertise in, let alone funding mechanisms and innovation components, which they're deeply interested in doing, and they're deeply interested in doing it in a global environment, not just in the developed world. I think importantly, I want to touch on that I think global employers have a role in addressing the issues of stigma in healthcare. And I think many of them have, and frankly in this room, have done that quite elegantly. And that's in particular for populations with HIV and AIDS, for women, and for areas of mental health. And lastly, I think my bias, and we'll touch on this, is that there is a format now within global employers due to the sustainability movement and due to the increasing value consumers place on sustainability. So there is now an integrated model in many enlightened employers that you can start to kind of do work. So employers have OC health safety, and I might add that this room really has the brain trust for OC health work here. So I won't even touch on it with the audience that we have, just starting with Clarion. But you know, those organizations have worked themselves in silos. So medical benefit coverage worked in one area, and human capital and talent worked in another, and occupational health and safety worked in another. But sustainability and the concept of that is really starting to form a model within organizations for them to really address this. And so again, I think that that's a really good place when we start to think of where would you start with employers. That's one area. So I'm going to, again, though, really in the spirit of both time and the hopes for dialogue, really kind of limit my discussion to how employers view, you know, the issue of healthcare through the lens of their own employees. And this data comes from the Conference Board, which does annual surveys of CEOs. And frankly, this has really been, even post, you know, certainly maybe it dropped a little in 2008, but post-2008, a major issue for CEOs of major organizations is talent. And that's because there's really both a dearth of it, and more significantly, there's real disparity in where it is, right? So where I need talent and where it is are geographically really diverse. And increasingly, particularly for US multinationals, their employees are predominantly outside the US, and their growth is outside the US. So they are very invested in competing for talent outside the US, and particular types of talent, quite frankly, engineers, obviously, STEM workers, and I'm delighted to say women. Women are coming into the workforce in a way that they have never come before. They are graduating college at higher rates than their male counterparts. They are entering graduate schools at an increased rate, and they are increasingly entering the workforce. And so how to make them successful in the workforce, to be able to retain them in the workforce, is an important issue. And it's a place where healthcare has a role. So why would an organization, a for-profit, shareholder-based organization, really care about healthcare, right? So we're actually in the US obviously having this dialogue right now, because this is the opportunity, this is the window, this is the month you can get out of covering healthcare. And what you find is not a big exodus, right? We haven't seen thousands and thousands of employers run for that door. They are invested in the healthcare and the health of their population because of some of the reasons we bring up here. One is that there's good data that just in regards to brand, which is probably the key asset that any employer has, and particularly in the developing market, when we look and ask consumers globally, what they think about organizations, what they trust about organizations, healthcare is increasingly coming up. How they treat their employees, whether they cover the healthcare of their employees, is increasingly coming up the list. And in addition, when you ask employees, does your organization care about your health and well-being? When you ask that question, as they do in the World Economic Forum, they answer, for those who say, yes, my employer cares about my health and well-being, those people are 8 times more engaged. And engagement, employee engagement, is the currency in which we track productivity and innovation of a workforce. So those people are 8 times more likely to be engaged, and they are 4 times less likely to leave their employer. So this concept about caring about the health of your and well-being of your employees is an important part of the employer value proposition. Here at Mercer, which is one of the largest HR consulting firms in the world, and I am delighted to say that we have had the pleasure of working with the World Economic Forum on something called the Human Capital Index. This came out in 2013, and the goal of the Human Capital Index was really to look at countries and understand how they are developing and deploying their human capital. And we looked at it with 4 pillars. One is education, right? Which actually I think has a fair amount of crossover with health, because in fact what we're finding is that employers who are not, it's very typical for employers to be involved at the university level, but what we're really looking is employers to kind of go further down into the high school or into the other, even secondary schools curriculum, to really start to understand how you can create workers for the 21st century. So things like emphasizing STEM and emphasizing it in particular for girls. But I think what's important obviously for this audience is that health and wellness is there. So health has made it to the discussion at, one can argue, one of the major major arenas for business, the World Economic Forum, and it's held as an important pillar for human capital development. So you can go on and download the report if you like. It's always fun to kind of look and compare whether or not you think Sweden should be 3rd or not. And frankly, to be frank, there's not a lot of surprises. Northern Europe does very well, the US not so well, and the developing world is struggling in some environments. But that said, it's a good place to kind of have a benchmark and have a dialogue with whether it's governments, whether it's other types of communities, and more importantly for employers, what it tells employers is, where are some of the gaps? if I'm going to go in and invest and build some kind of plant or start an R&D firm in this market, what are some of the gaps when I look at the systems that exist that I'm going to have to fill for my human capital? And so the major way in which employers address health, it's not the only way, and in fact, when we talk about on-site clinics and we can talk about other kinds of things, but the major way in which employers currently address extending health access is through supplementary health coverage. All right, so supplementary medical coverage varies depending on the public system that it's supposed to supplement. And as you can see, it's increasingly popular within the private sector to offer supplementary health, and that is logically in response to the fact that public systems are increasingly under duress and employees are looking for options and they're looking to their employers to cover that. Frankly, governments are doing the same, and sometimes they do it with a carrot, like an incentive, and sometimes they do it with a stick, like a tax. So I think employers, this is another area to say, if I'm an employer and I am contributing to the health of my community, is there some way that that could be graded? If I can, and so I think, again, this is another area where when we talk about supplemental health and we talk about either incentives or taxes for offering it, this is a key part of a dialogue with the private sector. That said, and again, if you kind of review some of the numbers here, this is nothing in comparison to the informal workforce that we've been discussing. But what major employers are recognizing is that the supplemental plans that they have put in place still do not meet the needs of an individual who is confronted by a health issue. And so this is an example out of China for breast cancer based on just an average salary and healthcare costs, albeit in the coastal areas of China, which I'm sure many of you know are just as high as Boston or New York or Washington. And so supplemental health insurance hardly meets the needs of this individual. So even workers with supplemental health insurance are going to be confronted with, pretty dire fiscal restraints if they have to deal with a serious health issue. And so one of the ways that employers are looking at it is through different kinds of flexible benefits and other additional insurance buy-ups, but we can all agree that's still very challenging. The other component that I want to switch gears now and talk about is the reality that supplemental health coverage, which is generally provided by either a local insurer like a Ping An in China, or you aggregate it in different types of pools like for an AIG, et cetera, or Swiss Re, a lot of European insurers. A lot of these supplemental insurances are clearly regulated. And sometimes those regulations are frankly counterintuitive, though I'm sure that they had some purpose at some time and when they were designed. And in addition, they have real limitations on them. And frankly, they have very inflationary incentives in them, so that people can only get access to care on the supplemental if they go in the hospital, for instance, rather than if they go to an outpatient. And this is actually an issue we see in India a lot, where people are going into the hospitals and to get care that they probably can get in another venue. And in addition, there are really elements that are not covered that don't make sense clinically, right? So it doesn't make sense not to cover vaccinations. Again, I'm a pediatrician, but other than Jenny McCarthy, I think most people agree with that. It doesn't make sense in my mind to not cover pregnancy. But in addition, we start to see other things that I think are kind of associated with stigma. So certainly HIV and AIDS is one of them. So we looked at this issue, and we did it, and I can say their name because they're a delightful partner and really a pioneer in this environment, which is Levi Strauss & Company, and looking at whether or not the exclusion on supplemental health plans to HIV and AIDS coverage was disproportionate to things that we really, from a clinical perspective and from an underwriting perspective, could say are really comparative, right? Is from an underwriting perspective, is HIV really that, is it different than hepatitis? Is it different than TB or a chronic disease like diabetes? And some of the exclusions and limitations on HIV plans, on plans for HIV and AIDS coverage, are really, approach the ridiculous. So 5-year wait times, or you can only get coverage if you got acquired the disease through a blood transfusion, on the 34th floor. So really making, rendering these the coverage as utterly, useless. And so employers have a keen desire to get what they pay for. And so if they are paying for this insurance, they want to make sure that it's being appropriately executed and utilized. And so in this area, this is a place where we see not only individual employers, but we see aggregate activity to really push back on insurers and try to understand why these exclusions exist. And I'm happy to say, and we presented this data at the International AIDS Conference, and we just presented the update in Australia, that we've been very successful in negotiating for really limited amounts of money or nothing at all in regards to premium to have inclusion for HIV and AIDS. And we utilize standards including both diagnosis, treatment, and counseling. And what's important about that is it really starts to have an engagement about why those types of exclusions exist. And so I now want to kind of take AIDS as a model, because there's really, the GBC has a very nice model where you start to talk about HIV and AIDS care, and in particular where prevalence rates are very high, obviously in South Africa and throughout the continent. And that's been a model where I think employers have been very effective, and they've been effective because it's improved the productivity of their population, right? So De Beers, in fact, was one of the first organizations to cover HIV coverage, and frankly, they could not run their mines unless they did that. However, it's evolved since then. And so what you see is HIV and AIDS being discussed, and here is an example where the extension of care is not just in insurance, but in fact in absolute care. They were the largest providers of ARV in Africa. And then you take Chevron as another example, who now moved that clinic, now has taken the kind of system that they have built up for HIV and AIDS discussion, and they've now extended it into maternal health, they've extended it into talking about domestic violence and other things, and they are starting now to extend to talk about chronic condition management as well. And here, the example of malaria is another example as we start to segue into really my last comments about communities, is a recognition that it's not just your workers, and that how you impact the health care of your workers at the work site, so which is sort of typical or traditional OC health and safety. But in fact, it's these movements, and obviously Dr. Barber can speak to this in regards to not just safety at work, but safety at home. And in the modern era, safe at home means having a safe access to water, safe access to healthy air, safe access to healthy food. And so the dialogue is changing. But again, malaria is a good example where it didn't just happen at the workplace, but the recognition that you had to go into the community to impact that. And so with that, I'm going to just end on this slide and talk about this concept of sustainability and the extension of human capital as a really sustainable asset. And how do you sustain that asset? And how do you do it with in the communities that you work, and in the communities you live, and the communities where you attract and retain your talent, as well as where your customers and consumers live. And so these are some examples of companies who have really, have taken human capital and health management, not only of their employees, but really also cross-pollinating with their CSR efforts. So for instance, Colgate spends a lot of time trying to look at ways to modernize and protect safe water. And in addition, I think Patagonia obviously has sort of addressed what they call the elephant in the room, which is growth-based capitalism. And again, I sort of leave with those words because I think that that's part of this dialogue as we talk about involving the private sector. Thank you.
Thank you, Lorna. All right, questions or comments at this point? Yes, yes, behind. Go ahead.
Hi, Yuka from the ILO again. I'm very glad to know that some employers extend their health coverage to the prevention and or the healthcare for the or the prevention for the community. It's really good example and good practice. And perhaps it's the one of the CSR, corporate social responsibility, or the global health chain, global chain, supply chain. But my question is, how can we motivate, or what is the incentive for the private sectors to support or promote safety and health of informal economy workers? Perhaps in some industry, for example, garment sector or the construction, they have some responsibility in terms of the global supply chain. But if there's no connection at all, how can we motivate? And actually, in reality, some company, even if they have the subcontractor, subcontractor, they ignore their responsibility. So this is the reality. So your idea how to promote the informal sector workers.
So, first, thank you for the question. It's clearly the $1 million, if not $1 billion question, which is, and in particular, about supply chain. And I think that's the structure in which, from a private sector, how I manage my employees is extended into how do I manage or assist my supply chain. And I think that if you look at, HP, for instance, I think has made efforts there with her story or her health programs, and they are looking at extending, programs from a programmatic, which is different than insurance, but from a programmatic perspective, extending those programs into the supply chain. But I concur with you, that's really, from a structural perspective, that's sort of an obvious place to have the dialogue.
Other questions or comments at this point? Yes, Francis.
My name is Francie Lantella. I'm from the Uyghur organization. As a matter of practical fact, I don't know how and under what conditions you can draw the line, I'm not talking about you personally or your employees, between formal and informal in that sense, because it changes. It's a moving thing, sometimes seasonally, but that's the easy one, in fact. Other times it's according to the contract that the global employer has taken on to produce against a certain date. So it's actually bureaucratically, as a matter of practical and import, quite hard to actually, I think the value chain analysis is extremely important when the workers are inserted in there also, but I think it's harder and harder to do. And I think it's not a question, it's asking for your comment, or maybe we can follow it up. Thank you for that space.
Great, we will go ahead. Marty, did you want to come in now?
Initiative in the UK, and what they have been finding through the companies that are part of that is that more and more of the first level suppliers are using contract workers. It's not just the suppliers way down the chain. And we're involved in looking at some of that happening at the first level of suppliers. So if there's room for dialogue, we'd be happy to.
Just before we go on, I want to toss out a question to all of us. Part of the challenge of working in this space, part of our challenge in these days, is that there is a large community of practice, body of knowledge, people working on health, global health. And there is another community, as Marty and others in WeGo would know, who've been working on informal workers. The degree of intersection hasn't been that great, and yet could be critical to making progress in this whole area. Let me give you one specific example. What about workers who really cannot leave their workplace? They're informal workers. They may be a street vendor. They may have a vehicle that they drive around, the delivery of people or goods. Cannot leave their workplace to go get health care. And yet all of our healthcare thinking has been about a system that has fixed facilities that have hours. They're open, they're closed, you have to go there. And yet these workers cannot go there, or they will lose their income for the day. These two communities need to come together around practical questions like that. Maybe we'll come back to that, but for now, let's go to Marlies, our third panelist.